Welcome to Pregnancy Myths and Truths. I am Dr. Nikhil Datar, gynecologist from Mumbai. When any pregnant girl comes to me, her first question, what she is interested in knowing, is that will she deliver on the due date that I have given to her? And it is quite natural because she wants to plan everything. Her bag needs to be ready. She wants to go through all the rituals properly and correctly. She wants to do her shopping. She wants to do her maternity shoot. She wants to plan the day absolutely correctly. But as and how the days pass, she goes through a sonography. And sonography brings us a different due date. So she gets more confused and again comes back to me and asks the same question, that there are different due dates that are with me. On which day am I going to deliver? Am I going to deliver on the due date given? And the honest and the truthful answer is that you are not going to deliver on the due date that is given to you. Actually, I would scientifically say that the chance that you will deliver on the due date given to you is only 5% and not more than that. So it means very few people will deliver on the due date that is given to them. Then naturally, the next question comes up is that why is the due date being calculated? And the answer to that question is that basically due date is a rough estimate of when you are going to deliver. So as a doctor, it gives me an understanding as to how advanced is the gestational age or the pregnancy. So when I do the checkup, I come to know that, okay, you are 6 months pregnant and the baby is also seeming to be about 6 months pregnant. There are certain tests that doctor needs to advise at a particular point of time during the pregnancy. And that is why we need to have a rough estimate of the gestational age or the age of the pregnancy. And that is why we give due date to patients. Now, it is very important to understand that 80% patients will deliver in the 15 days or that span of 15 days prior to the due date. So to give you an example, if 31st of May is the due date given to somebody, generally 80% people will deliver between 15th of May to 31st of May. About 7 or 8% people may go beyond the due date that is given to them. Let me clarify that any delivery that takes place in the 3 weeks time span prior to the due date is called as a full-term pregnancy. So it means if the due date given is 31st of May, then any delivery that will take place after 7th of May is called as a full-term delivery. So which means that the baby is completely mature. Now let me give you a little bit of understanding of how the due date gets calculated. Well, human pregnancy is by far and large supposed to be for about 265 or 266 days. Obviously, the pregnancy starts when the egg gets fertilized. Now, the problem is that except if you are an IVF pregnancy, when you are on the treatment, in general parlance, nobody would come to know as to which was the exact day when the egg got fertilized and you got pregnant. Hence, we backtrack the whole thing to the first day of last menstrual period, which means we add about 14 days to the period 266 days, which gives us roughly around 280 days or 40 weeks. In short, if we add 280 days or 40 weeks to the first day of last menstrual period, then we get expected due date. This whole formula will work reasonably accurately if you have your cycles coming very regularly and at 28 days interval. Now, if the irregularity is more, less correct the calculation is going to be. Many people will want to know that is sonographic calculation little more accurate? And the answer is that yes, sonographic calculation will be little more accurate because the sonography machine actually takes the measurement of the baby and in accordance to that calculates the expected due date or the due date for this particular pregnancy. If sonography is done in the first 3 months of pregnancy, then that is supposed to be the most accurate due date according to the sonography. Lot of people come to us with the last sonography done at about 8 months, and they think that it is the latest sonography and hence that is the due date, but that's absolutely untrue. The sonography which is done the earliest in first 3 months will be the most accurate for prediction of the due date. Now, once again, I want to draw your attention that when we say accurate, it still means only 5% chance that you will deliver on the due date that is given to you. Many a times we find this very confusing situation in terms of how does one calculate month wise and weeks wise. And we commonly find this situation because the mothers and the mother-in-laws will come forward to us. They want to calculate things according to the months because they want to do some rituals in pregnancy, whereas the young girls are calculating their pregnancy in according to the weeks, and they always find a mismatch between the months and the weeks, and this causes confusion. So let me explain it to you in a very simple manner. Every week has 7 days. Every month except the month of February has 30 or 31 days. So it means by far and large, 1 month is equal to 4 days plus 2 or 3 days. Now, if we calculate the whole thing over 3 months period of time, then what happens is 3 months is equal to 12 weeks plus 2 or 3 days, 2 or 3 days, 2 or 3 days, roughly around 7 days. That means roughly around a week. It means that 3 months actually comes to around 13 weeks, not 12 weeks. 6 months comes to around 26 weeks, not 24 weeks. And 9 months comes to around 39 weeks, not 36 weeks. Hence, the expected due date is calculated as 9 months plus 1 more week, or 39 weeks plus 1 more week, and 40 weeks. Ultimately, whenever we do all this calculation, I told you, and this is the third time that I will say it again, that the chance that you will deliver on the due date is not more than 5% at any given point of time. And hence, calculation of expected due date is important but an extremely inaccurate method of predicting when are you actually going to deliver. So here are few important tips that I want to give you about the expected due date. Number one, that it is very important that you give the correct first day of last menstrual period to your doctor. It is important that you give information about the duration of the cycle. That means how frequently do you get your menstrual periods and are they regular or no. Number three, accept this fact that by far and large, most of you will deliver in the span of 15 days prior to the due date, and don't expect that anybody will be able to calculate the exact day on which the baby is going to come out. You may be surprised to know that actually speaking, there have been a lot of studies which have said that the days of pregnancy or the length of pregnancy even varies according to the genetics. Blacks and Asians are supposed to have little shorter pregnancy as compared to whites. This is what is the data that says. In short, an inaccurate method, but still very useful. Watch for your expected due date. By any chance, if you cross over your expected due date, do definitely report to your doctor so that the baby is correctly watched for, and if there is any problem, it can be solved. Thank you very much.